Welcome, everybody. You are at the Seattle King County Coalition on Homelessness's Public Benefits Are Key. This is our training series on all things public benefits. Today, we are going to be talking about Age Blind Disabled, or ABD, and the Housing and Essential Needs Program, or HEN. So we are joined today by Tricia Matthew from Catholic Community Services, who operates and manages the HEN program here in King County, and then Hannah Rosenberger from Solid Ground, the benefits legal assistant, attorney, team clinic over there that is really helping folks navigate all things public benefits. State related, I should say, I think. Good, I'm getting a nod there from Hannah. So we've got a ton of really amazing information for you today. This is our third time offering the ABD HEN training for folks. The previous two were in 2022, so these things change as the legislation changes, and so Hannah will highlight any changes that may have happened from the previous year. We are recording this, so it will be put up with an updated blog and updated slides on our website. Tim does an amazing job of really summarizing these trainings, pulling out the highlights. Anyone that has registered, even if they're not here today, will get that email saying, hey, the blog is up and ready. Thanks for joining us. Probably next week sometime. So you take notes as you will, but you will have all of this information after the fact. Before we really dive in with our wonderful guests and presenters today, I just want to take a couple minutes. Our Public Benefits Are Key is sort of a large body of work that the coalition works on. For those of you a little less familiar with the coalition, we're not a direct service provider. We do a lot of policy and advocacy around housing justice, homelessness. We really are working to support all of you who do this incredibly amazing work, keeping people safe, housed, fed, connected to care. And so we do that at a very hyper-local level, you know, city, county. We do it at the state level, particularly around public benefits, and then sometimes at the federal level as well. And trainings is a huge part of how we try to support all of you. And public benefits are key. Big body of that work is our trainings. So we do the ABD HEN today. I believe it is May 31st, but don't quote me on that. We'll drop the link in for you for sure to register. We're going to do TANF, so Temporary Assistance for Needy Families, and Work First. Then later in the summer, we're going to do Medicare, Medicaid. We are working right now for in June to do a sort of a deeper dive into SSI and ABD. So Hannah's going to join us with our Benefits Law Center colleagues to really talk about a deeper dive into those two programs and that transition from state benefits to federal benefits. So that's in the works. We're probably going to do another one on food benefits. So that's also something that we're contemplating. And this is all based on feedback you all have given us, what you want more of. So we are going to drop a post-training survey into the chat now, pre-training, just so you have access to it. We really, really do look at this information. We had 3 sort of open trainings that we knew we were going to be doing with Hannah and her team. And we have based the subject matter and the topics that we're going to dive into based on that feedback that you all have given us. Many, many, many of you have said, hey, I want to talk to you more about my experience working with clients to help keep them on public benefits, to maintain those benefits, to improve those benefits for folks. And we are starting to reach out to folks to say, hey, you said you wanted to talk more. Is that still true? And that's an option on these feedbacks too. So please fill those out. We really do look at them. We really do take it seriously and focus our program around that. The other thing I wanted to share, and hopefully you all have seen this, because if I did a thorough enough job, which is not always the case, folks sometimes get missed, so we're going to catch you here. We are hosting a quarterly provider forum. It's kind of a shop talk, and it's all about public benefits. Our first one is going to be April 27th. We're going to throw the link to register for that into the chat. It is going to be, I think we've scheduled it for about an hour and a half. Hannah is going to be there talking a little bit about just what folks with different immigration statuses are eligible for around state benefits. And then our colleagues from Mary's Place are going to be there also, just to very informally talk and present about the work they're doing to support some of their folks with varying immigration statuses on their path towards accessing public benefits, which we know is a really key step on the path towards housing and stability. That's going to be kind of what's going to, hopefully draw us together for the first, 45 minutes or so. And then we really want to open it up, because this is a chance for you all to actually get to know each other, right? Like it's great to, and I'm loving seeing all of the names and the organizations in the chat, but that's not an actual chance for you all to talk with each other and learn from each other and share really good information, just what you're seeing in the public benefits world. If you have ideas of what you want these quarterly forum shop tops to look like, we are super open to that. You can email me, you can email Tim, you can drop it in the chat, you can tell us when you show up on April 27th. We really want to convene you all and have an educational or resource sharing component to it, but we really want it to be for you all and what you need it to be, and make sure you're connecting with each other, because you're all doing this important work and you're all bringing really important perspectives to it. So taking a little extra time this morning because it's a new component of the work we're doing. Part of what we're also going to be, sort of listening for and hearing is just, themes or issues that you all are seeing that we sort of want to then take back internally and sort of be like, okay, we're hearing, this particular issue from a lot of folks, and they're, this is what they're navigating as they're trying to, help people get on benefits, and really think about is there anything that we can do advocacy wise around that, right? Because we want you to be able to have the information you need to help folks apply for benefits with relative ease. We want you to know the tips and tricks that are going to help get folks the benefits that they are eligible for and entitled to, and understand that and help them understand that. We want to maintain these programs, that are working for folks, and then we want to improve them. So we're really coming at this from a very holistic, all arms wrapped around this subject in a lot of different ways, and we really appreciate you all showing up and walking this way with us. So my last plug that is not public benefits is tomorrow is our general membership meeting. We hold that the third Thursday of the month from 9 to 10:30. Trisha and her team from HEN are going to be back tomorrow with us. Thank you for dedicating so much of your precious time to the coalition. They're going to share some really amazing testimony that they did at the state legislative level around advocating for funding for HEN in the budget, and around ABD. We'll get updates on those bills coming through. We've got new healthcare for the homeless staff that are going to come and introduce themselves and talk a little bit more about the monthly naloxone harm reduction training that they're hosting for providers. We have other Catholic Community Service staff joining us from the Tenant Law Resource Center to talk a little bit about what it means if some of your clients have an eviction on their record and the laws around when that can be disclosed or not. And then they've got a really brand new live hopping, super busy resource line where folks can actually get real-time connected to lawyers around tenancy questions. And then Council Member Girmay Zahilai is going to be here too in an unofficial capacity to talk about the King County Prop 1 or the Crisis Care Center levy. So we have a packed agenda tomorrow. And on that note, I'm going to stop talking and let you all hear from. We're going to start with Tricia and Joseph from CCS, the Housing and Essential Needs Program. They're going to talk really about what this program is looking like on the ground, good information for you all. And then we'll hand it over to Hannah to really talk through the eligibility and all the ins and outs of applying and things. So before I forget, we do have closed captioning. So I do see someone has got that going. So great, that is an option for you if that is helpful. If you don't want to be included in the recording, just stay on mute. Drop your questions or your comments into the chat. Tim and I are going to monitor that. We'll make sure it gets answered one way or another. But you're always free to raise your hand and then we'll call you and come off mute. So on that note, Tricia and Joseph, welcome. And I hand the floor to you.
Thanks, Jody. Good morning, everybody. And thanks for being here. Such a nice large group. I'm going to go through the presentation and then Joe and I will both be available for questions afterwards. If you have any, we'll just quickly go in. So we're with the Catholic Community Services. We do the HEN program in King County, throughout all of King County. It provides access to essential needs and potential rental assistance and utility assistance for low-income adults who are unable to work for at least 90 days due to a physical or mental incapacity. The program is funded by the Washington State Department of Commerce, but eligibility is determined by DSHS through a network of homeless and homeless prevention service providers, such as yourselves. And then it's managed by our organization through a contract with DSHS, with the county. To qualify, applicants must have a disability, physical and or mental and or substance use disorder, and have zero income or be receiving ABD, which you'll learn more about later. And applicants can't be receiving any other government cash assistance, such as SSI, TANF, unemployment, etc. So what HEN provides, right now, all HEN eligible folks can enroll with CCS and get transportation and essential needs. So what that means is they get an annual Orca Lift annual, subsidized annual pass for a year, and they can come in and get a monthly bag of hygiene and cleaning supplies. And then, when they come in and do their intake with us, we can provide some sort of light case management referrals. And then coming soon, we're getting trained to be CEA assessors. So we'll be able to enter folks who are unhoused into that system if they're not already in that. We do some other assessments down there too. So some of you may have heard the word TEN or not out there in the world. What we're kind of internally calling this at CCS is TEN, which stands for Transportation and Essential Needs. Basically, that's kind of our pre-rental assistance program that we're doing now. This just started in December. During COVID, there was a waiver and we weren't bringing any new folks on. And so when we reopened to start enrolling folks again in December, we decided to do it in two parts. We're now doing intakes, again, just transportation and essential needs. So everybody gets that. Anybody who's eligible and comes down can get that at least, because before we weren't able to just bring anybody on for anything. So now at least we have that. And then when there is funding available, then we can bring new folks on to provide rental and utility assistance. So that is up to $1,000 a month. And then we can also provide move-in assistance, including application fees and deposits up to $1,000 every 2 years. And then one-time back rent assistance up to $1,000 for folks as well. We do not provide rent or utility payments for households that are living in subsidized housing. So Section 8 vouchers. So this is just for folks outside of that. So just kind of a note about what we think we do pretty well there. We provide, that financial backbone, the essential needs supplies, and kind of light to moderate case management. We're not set up to support higher needs clients, and due to high caseloads, we can only provide light housing navigation for unhoused folks. So we're not like going with folks to find housing, but we are, like helping them helping them find places. And we unfortunately do not have funding to match the needs. So while we are bringing folks on, we do not have rental assistance for everybody that we're doing intakes with. What we cannot do intakes for anybody who is not currently made HEN eligible by DSHS. So when folks come in, we check the benefits verification system to make sure that they have been made eligible. And if so, then we can serve them. And so that just to be clear with everybody, that includes folks that are already on SSI or SSDI at intake, because they would not be HEN eligible. There was a pilot project in the past where we were bringing folks on. That is not a pilot project anymore to bring folks on that are already on SSI. So if anybody still has old flyers up, we've heard recently that some people might. So please take those down and know that we can't do that for folks. We have been given some temporary permission to keep folks who fall off of HEN eligibility while they're on, because they've gotten SSI, because there's still sort of that benefits cliff with those folks. And so we do have some additional funding to support some of those folks right now. Not sure how long we'll be able to do that, but like if somebody becomes HEN ineligible while we are currently paying their rent, we've been given permission to keep them for the time being. So how to enroll in HEN once somebody has gone through the DSHS application process, and they've gotten a referral from DSHS to HEN. They want to call our resource line, the numbers on the screen, to confirm, just double check their eligibility. Sometimes they get those letters and they might fall off of eligibility, like they don't call in like for 3 months, 4 months. So we just want them to call that resource line first, double check they're still eligible. And then they can come down to the Phoenix Center. We have open hours Tuesdays, Wednesdays, and Thursdays from 10 to 2, where they can just come in and meet with a case manager and do the intake right there and walk home with their worker card and their essential needs bag. If they are somewhere else in King County and cannot get down to us, we can do remote enrollments. It's not ideal. And it takes longer, and there is a little bit more of a waiting list because we have to get folks. But if folks are down south and they can't, they just call the resource line and we can figure out a way to meet them where they're at, like whether it's doing an online enrollment or whatever. We'll work with folks to get them enrolled if they can't get down to the Phoenix Center. And we're hoping in the future that we'll actually be able to do intakes down south as well. Did I miss something over here? Yeah, we're generally doing about 10 to 15 intakes a day. And then we also, let's see. Just go to this. So do folks go on a wait list for housing assistance? That's something that people are asking. In the past, pre-COVID, the way that people were getting into HEN was they would have to call the first of the month. And like, if they were lucky enough to get on when they're, they were the ones that were first in line. That is not the way we're operating it anymore. So it's not a wait list. We kind of have this pool of folks that we're doing these intakes with. So it's not first come, first served. In order to create a more equitable system, we're now prioritizing people who have gone through the intake process based on data gathered through the intake and assessment. So we are doing the consolidated housing assessment, and we're getting numbers assigned to that, and we're basically trying to move folks when rental assistance becomes available based on data more than just first come, first served, so that we can get the right people into the program as quickly as we can, just because we do have that limited pool. So just some current stats, there's over 9,600 people available or eligible in Seattle, King County. We've got about 2,700 currently enrolled in HEN. Fully enrolled in HEN right now are 2,237. And then down at HEN, sort of in this pool of folks that are waiting for rental assistance to hopefully become available, there's a little over 500 folks in that pool. And again, we're bringing on about 40 more every week. We've given out, a couple thousand bags of essential needs supplies and 400 orca cards since we opened in December down there. So when they do enroll, we collect demographic information. We do this consolidated housing grants assessment. And I just kind of talked about this, and all this data collection is sort of helping us understand a little bit more about our clients and being able to serve people better. Our location, so we've got that HEN resource line. We're at the Phoenix Center. We're doing those intakes. That's at 23rd and Rainier in the Central District. We also have the Randolph Carter Center is where we have the case managers that have clients that have already gotten into the HEN program and are working directly with housing case managers. They meet with them at the Randolph Carter Center, which is at 23rd and Yesler. And anybody can also call the resource line and arrange to come in and pick up their essential needs bag there at that location as well as at the Kent Family Center down south. We also have a Federal Way location with just 2 case managers there as well. And that is all I have. So got Joe on here, and I will just open it up if anybody has questions.
Well, we did have a couple questions. So Adam asks, to be clear, currently there are no new enrollments happening for HEN rental assistance.
When money becomes available, we're rotating people on. So actually, we've just moved over about 50 new people. Well, actually more than that. We're moving on about 100 people right now. We're in the process of that. So as people fall off, we'll be able to have more people come on. We are concerned because it does look like we're going to be starting this next cycle with a deficit. We didn't get the additional funding that we were trying to get to help us maintain. And then also with us keeping some of these additional people that are going on to SSI or SSDI, it is providing fewer slots for people to roll in on. So we're kind of doing the best we can. Like as folks roll off, we'll be able to bring more people on. So it's not that we're specifically not, but it's going to be a slower trickle on.
Thanks, Trisha. And then Odessa was asking, how do we assist clients that are HEN eligible with receiving ABD? And I did throw this in the chat, but I believe that is what Hannah will be covering in her section of the training, really helping folks that are eligible get all the benefits that they are entitled to. And then if someone has a Section 8 voucher, disability, and 0 income, can they get the non-housing benefits of HEN?
Yes, if they're eligible for HEN, they can. Yep, absolutely. They can get the ORCA card, they can get the essential needs bag.
Wonderful. Can someone qualify for ABD and not HEN? And if so, why would that happen, or vice versa? So, and that might be I'll turf it to our HEN folks, but that might also be a really good question for Hannah as well.
Joe, do you know the answer to that?
Yeah, Amanda, that's an excellent question. I think generally if somebody's qualifying for ABD, they should qualify for HEN as well. We do occasionally have folks that qualify for HEN and are not actively receiving ABD benefits. In the past, it was mostly listed on BVS, the DSHS kind of database as pending. So they were in the process of, probably providing documents from their medical provider verifying the disability. Recently, that kind of changed and it's a little bit more murky. But I think occasionally there will be folks that qualify for HEN but aren't actively receiving ABD.
Thanks, Jeff.
And then I see Lisa in the chat asked, how long is HEN housing? And then also, what if they are not approved for SSI? So that's a really good question. There isn't like a finite timeline for somebody being able to receive HEN. Realistically, as long as they're meeting the criteria set by DSHS, which again is like, 0 income or ABD, and then a verified disabling condition. And they continue doing those consistent recertifications with DSHS, they should continue qualifying for HEN. We don't really impose any internal limitations on that. We do check clients' eligibility every 3 months. But by and large, people are going to continue to qualify. So for example, we've had clients who have who are still working on the SSI process, or who've experienced interruptions in the SSI process, but have continued to be receiving services from us since 2019, 2018. So quite a while. The main change is going to happen when clients typically return to work or begin receiving SSI or SSDI, or move out of the county. And if they are not approved, I'm sure Hannah's going to touch on this. I think a lot of times folks go through like multiple denials of SSI before actually getting approved. So it's pretty common. Again, we're not really like, we don't really have the capacity to look and make sure that people are still on the SSI track. We kind of assume the DSHS is helping out with that.
And Hannah, was your response in the chat related to what Joseph was just talking about?
I think I entered it a few seconds too late. It was the question about why would someone maybe get HEN but not ABD and vice versa. So a little late on my chat there.
That's okay. So let's get that into your answer into the recording. So if DSHS determines that a person's disabling condition will last less than 12 months, they will just be approved for HEN, not ABD. If the disabling condition is primarily due to substance use, then they can still get HEN, but not ABD. Thank you. And then we've got some good questions coming in fast and furious. So intakes are scheduled at the Phoenix Center and then directed back to DSHS is one of the questions.
That's incorrect. It'll be DSHS and then they kick it down to the Phoenix Center. So just opposite.
So they're doing a separate intake with DSHS, and then DSHS refers them to a variety, us being one of them. Then they would come in and do a HEN specific intake with us. It's kind of a more limited one at the Phoenix Center, and then if they get rental assistance, then they move over and do a housing intake, as like kind of a little bit of additional with the housing case manager.
Okay, Caroline's got a great question here, and this might also, I'm just going to like highlight some stuff that's coming up that might be really good conversations for our quarterly shop talk. I'm just going to plug that a little bit because I think this is one of them. Odessa had another one too, or Sarah did. What can we do for folks who likely qualify for HEN but are on long waiting lists for mental health evaluations? Any resources any of you suggest in the meantime?
Yeah, that's another good question. If somebody is qualifying for HEN, we can do the intake and we can refer them internally to our CREW program, which can do that mental health evaluation. Similar to other mental health resourcing in the community, waitlists can be kind of long. So yeah, take it with a grain of salt, but we do have that internal resource and knowledge. But then, I mean, to be completely honest, what we've been doing is just kind of trying to patchwork with other community resource providers. We do a lot of, and this is not by any means like always a super good option, but we do, a lot of referrals to like sound drop-in appointments and stuff, just to see if people can get in the door. I think, not totally clear on this, but I think DSHS shoulders a little bit of that load and does some type of referrals when folks go in the door there and initially get connected to.
Great. And I see your hand, Lisa, and I'm just going to hold for a second here because I'm just trying to catch up with some of the messages that are coming through, because I think a lot of these are going to be answered by Hannah in her training, and I don't want to cut that short. So I might just take a quick minute and just, Hannah, if there's anything that you're not going to cover, will you flag that for me?
And what I'll do is there are some really great questions about like mental health diagnosis plus substance use, or, when there's that dual diagnosis. I don't know that if that's explicitly in the presentation, but I'll add it there because I do have a little placeholder. So I'll answer some of these questions as well. And if I still forget or miss it, I also have plenty of question time built into my presentation. So we could fill that out too.
Great. I appreciate that. And Tim, I might ask you to pull some of these questions just so they don't get lost, and make sure that we cover it with Hannah's, because these are really amazing questions that are coming through, folks.
Absolutely. I will keep track of them, and we'll if we can cover them today, we'll review them in the blog. Yeah.
I'll also drop our admin email in the chat when we're done. Feel free to direct any questions there over time too, if something doesn't get answered today.
Yeah, and so like I said, I think we're going to cover a lot of these in Hannah's, but we've got one more specific HEN question in the chat, and then Lisa, I saw you put your hand down, but if you had a really specific HEN question, let's get to those two, and then I think we might keep putting them in the chat, and we'll collect them, we'll answer them either through Hannah, or we'll follow back up with Trisha and Joseph, and like Tim said, get them answered in the blog. So Roxanne says, if a client is approved with HEN rental assistance, can they still receive rental assistance from a rapid rehousing, diversion, or another rental assistance program?
That is a very good question. I believe that there are some limitations on rapid rehousing programs. I've had a client be exited in order to enroll in a rapid rehousing program, but again, it's a little bit murky. I think with co-enrollments elsewhere, I don't think we've experienced too many issues.
I don't think there's anything in our contract on our end that would prohibit us from paying up to the $1,000 rent, but it might be on the other side.
Great question. We've got a comment here coming in from our wonderful colleagues over at Benefits Law Center. Says, I encourage my SSI benefits clients that I think will qualify for ABD to seek that out. SSI approval can take a very long time, sometimes 9 to 12 months for initial decisions to happen. And if denials, we need to appeal, that adds more time. So I sometimes have folks that are waiting for years for SSI. ABD is absolutely important in the meantime, and I make sure my clients know that ABD HEN will stop and make sure they are aware that the work on connecting houses to other resources. So really, really great. I'm loving all of the questions coming in, and we're, like I said, we're gonna capture them, and we're gonna make sure one way or another we get them answered. If you're feeling like we've missed it and it seems like the appropriate time, throw it back into the chat for Tim and I, or raise your hand and flag it for us. Trisha, Joseph, thank you so much for being here and sharing all this great information. Really appreciate you being here. If you're able to stay on, we always love it. If not, we appreciate your time. Michelle, I see your hand.
Oh, yeah. I had a question in the chat. So when I was looking into HEN for a client a while ago, I read that they had to, in order to qualify for HEN, that they had to be currently houseless, specifically either living in a shelter or on the streets, or in like a place that's not fit for human habitation. I didn't see this mentioned in the presentation. I just wanted to confirm that this is still true.
Joe, you want to take that?
Sure, yeah. One sec. I'm gonna scroll up to the original question, or sorry, your original question, Michelle. As far as I know, as long as a client meets the precondition of having some sort of verified disabling condition and having ABD or no income, and DSHS approves them, they'll qualify for HEN. I don't think that DSHS takes the specific housing situation into account. We do when we begin rental assistance for folks, because we have both, unhoused and previously housed clients coming on. If a client is already housed, we do ask that their landlord sign some sort of verification letter that identifies them as being housing insecure or in an unstable housing situation. But as far as the initial qualification goes, I don't think that specific language around the type of housing is taken into account.
Okay, great. Thank you.
Thanks, everybody.
All right. Thank you so much for being here. Really appreciate it. Lisa, I see your HEN question, and we'll see if Hannah has an answer to that. Vincent, if you want to throw your comment into the chat or hold it, we're going to move on so we can get to Hannah's presentation. Thank you. I appreciate that. But folks, Hannah is a public benefits attorney with Solid Grounds Benefits Legal Assistance. She's going to give us a really great overview of ABD and HEN. So a lot of these questions might get answered with Hannah as well, and the specifics around the legalities of HEN and eligibility. Hannah also and her team has a wonderful resource that we call Ask a Lawyer, and we'll throw that email and that phone number in. And so that is another really great place that if you've got questions as you're trying to navigate things for clients, they can help answer those questions as well. And I'm seeing a question in the chat from Q, and we can look in to see about a Snohomish address, but since CCS really just does the King County portion, and the coalition really focuses on Seattle, King County, and we don't really, we have folks from across the state that join these trainings because I don't think they're happening in a lot of other places, if at all, but we really do largely focus on King County and then statewide. So anything outside of King County, we can see if we can find something for you, and we'll throw that in the chat if available. Hannah, please take it over, and thanks for being here.
Thank you everyone so much. I'm going to just share my screen and run my PowerPoint presentation, and then I'll minimize this screen. I do have, I have it near the end of the slide, but in Snohomish, King County, I have a little bit of information about who administers it in Snohomish. Those King County and Snohomish are the only counties I'm familiar with for HEN, so I'm not sure of other counties, but we'll get to that point. So like Jody said, my name is Hannah Rosenberger. I am the program manager with Benefits Legal Assistance. We are part of Solid Ground in Seattle, Washington. And I will be talking about kind of the ins and outs of the age, blind, disabled benefits, and there'll be bits of HEN thrown in there as well. So at Benefits Legal Assistance, we provide free legal services to low-income individuals and families in King County who are at or below 200% of the federal poverty limit. So we're working with low-income clients. And before we begin, I just wanted to at least name and acknowledge the fact that the public benefit laws and policies and systems that I work with, that we're going to be talking about today, are steeped in systemic racism and other forms of oppression. And there are still very harmful stereotypes that are used when speaking about recipients of public benefits. So it's not something that we'll have time to get into today, but I wanted to include some further reading for anyone that's interested, and just wanted to at least name and acknowledge that big elephant in the room. So these are kind of our agenda for today. The meat and potatoes of this presentation is really going to be about, how you as a service provider can help your clients successfully get through the ABD and HEN application and eligibility process. But I'll give an overview of the program itself. I'll go through the disability evaluation process, how to actually apply, some information about reporting if the client does get approved, and then kind of tips and tricks to avoid problems with benefits. And then what to do if something does go wrong, if you have a client that is on benefits and something has gone wrong, how do you resolve that? After each bullet point, I do have some time for questions. So again, drop your questions in the chat, or you can come off mute when we are in the question section. So I will get started. So first, as Jody mentioned, because you are attending today, you are able to take advantage of this Ask a Lawyer program. That's what we're calling it. So if you have questions about the application, maybe questions about eligibility, your client was denied and they're not sure what to do, or maybe there's a question about ABD reporting requirements, you can email your questions or real life scenarios to benefitslegalhelp@solid-ground.org. And if you put Ask a Lawyer in the subject line, one of our public benefits attorneys will respond. And the idea with Ask a Lawyer is we want to help with these issues before they turn into a denial or a termination, right? Before you need a lawyer to get involved. So this is for this email address. Clients can email there directly. It's also our intake email, but service providers can also email that directly. And I have a separate slide at the end with our general referral information, intake and referral. All right, so for today, since we are talking about ABD, age blind and disabled, I wanted to try to ground it in reality. So I have a fictitious client who's going to follow us through the presentation and help be an example for what we're talking about. So this is Sam, our client. She is a 45-year-old individual. She uses she, her pronouns. From our discussions with Sam, we learned that she used to work in retail and restaurants, but she hasn't been able to do that work. And now she works very part-time doing some food delivery, but she just hasn't been able to maintain consistent employment. She's also disclosed that she's been diagnosed with PTSD, depression, and arthritis. And we know that she's currently on SNAP, which is food benefits, but no other benefits. Okay, so keep Sam in mind. She'll show up throughout the presentation. So just a brief overview, what is ABD? What are we actually talking about? It's a cash assistance program to low-income individuals. The max amount someone can receive on ABD is $417 if they're an individual, or $528 if they're a married couple. ABD recipients, they also get help applying for SSI, that's called SSI facilitation, and they will get that referral to HEN, Housing and Essential Needs Program. So who is eligible for ABD? Well, the A stands for aged, which means someone is 65 years or older. I will say if someone is 65 years or older, they may also be eligible for SSI, but there are individuals that, for one reason or another may not be eligible for SSI, even if they're over 65, so they may be eligible for ABD. The B stands for blind, which means a severe visual impairment, and the D part stands for disability. So someone has to have a disabling mental or physical condition that keeps them from working full-time for at least 12 months. That doesn't mean that they have to show that they've been out of work for the last 12 months. It just means that their condition is likely to prevent them from being able to work for 12 months. And we'll get deeper into the specifics of that in a few slides. The disability cannot be primarily due to drug or alcohol addiction. The individual has to be at least 18 years old, and there are income and resource requirements and citizenship and immigration status requirements. If you're not sure if your client is eligible, you can check out, or the client can do this, check out WashingtonConnections.org. That's DSHS's kind of customer service website. There's this link, kind of like a quiz that says, see if I qualify, and you can enter in income and age information about the client, and it'll spit out a list of programs that they might be eligible for. So I want to pause here about that second bullet point about the disability related to drug and alcohol, because I know that came up in the earlier part of the presentation. If a client has, a dual diagnosis or co-occurring, a mental health and a substance use disorder, they can absolutely still be eligible for ABD. It's when DSHS determines based on the medical records that there is only a substance use diagnosis, that's the only diagnosis, or that's the primary diagnosis, that's when someone might get denied. But I will say, If you have a client that's happened, definitely reach out to us, because oftentimes it just means we have to help the client get, it may be a current mental health evaluation or some additional medical records, or maybe they have gone through treatment, so we just need to provide some evidence about that. So I'll leave that there, but happy to answer more questions about that. So I mentioned this already. These are the benefit amounts. You may remember 197. That's how much ABD was for years. It actually increased to 417 in September, I believe, of 2022. So that's the new amount. And then it's a little higher if there's a married couple. So I mentioned that there are income and resource requirements to be able to get ABD. When someone applies, they actually do the first, like the financial review is the first part. And if someone's not eligible for under the financial review, they're not going to get moved along to the disability review. So it is important. So for income, there are two different types of income, earned income and unearned income, and they're treated a little differently by DSHS. So earned income means income from a job. So if you're working, so you can divide the amount that you make, your gross income, in half, and compare that to the income chart here to see if you're eligible. So it's a 50% earned income disregard. Unearned income is basically money from anything other than a job. So unemployment, veterans benefits, maybe a family member is helping them, is providing cash every month. So in that situation, you have to take the amount dollar for dollar, and that income has to be less than the payment standard. So let's go back to our client, Sam. I mentioned that she was working very limited as a delivery driver. So let's say she's making about $100 a month, driving for Uber Eats or something. That's earned income. So DSHS is actually only going to look at 50% of that. So that's $50. And $50 is well below the monthly income limit. So she's still going to be income eligible. But let's say Sam was actually getting $500 from unemployment. That is unearned income. So DSHS is going to look at dollar for dollar. 500 is more than the 417 payment standard, so she wouldn't be eligible as long as she's getting unemployment. There are also resource restrictions. So an individual has to have less than $6,000 in liquid resources. And liquid resources means basically anything that can be turned into cash to pay for basic needs. So cash on hand, if you have a checking or a savings account, retirement fund, you have a burial fund, sometimes that might count as a resource. And you are allowed to have one car that is worth up to or less than $10,000. If someone has another car, that might be something that is going to be considered for the resource limit. And just a special note, if you are working with a veterans, and they have a VA benefit, individuals can receive ABD and veterans benefits at the same time. It just depends on whether their benefit is below or over the income limit. So if you have a veteran who maybe has a 10% disability rating, they may still be eligible for ABD as long as what they're getting from the VA is less than that income limit for ABD. I'm realizing I don't think I updated these percentage and dollar amounts from the last time I did this presentation. I'm sorry. So those percentages and dollar amounts might be a little bit different now, but again, as long as it's below the income limits for ABD, they could still be eligible. And then just a special note for ABD in couples, I mentioned that the benefit is a little bit higher if there's a married couple. That is if both spouses are disabled and receiving ABD. If only one spouse is applying for ABD, if the other spouse has any income, that might also be calculated in determining the income limit. This would be a good question for Ask a Lawyer. If you have a couple and you're not quite sure if they'd be eligible, you can reach out and we can help figure that out for you and the client. So other eligibility requirements, you do have to be a Washington State resident, and there is certain immigration statuses that are required. So either a US citizen or a national. I put this in quotes. This is the DSHS term, an American Indian born outside of the US, or other types of lawfully permitted individuals. And again, if you're not sure if your client might be eligible based on their immigration status, definitely reach out to us at Ask a Lawyer. Okay, I will pause there for questions. And I should have mentioned, I as I'm sharing my screen, I can't see the chat, so I will just ask our friends at the coalition if there are any questions I can answer at this point.
Yeah, thank you so much, Hannah. We don't have any questions yet for this section, but we do have a question related to ABD when we were talking about HEN that I think kind of relates that I wanted to bring up. So we had a question about, so we had the previous question, can someone qualify for ABD and not HEN, and kind of like how a person would be vice versa, eligible or ineligible. There was a follow-up to your response about a person being ineligible for ABD if their disability is related to substance use. They asked, what about a mental health diagnosis and an SUD diagnosis? Could that qualify them for ABD because they are HEN eligible?
Yes. Okay, that's perfect. I'm going to move to the next slide because I made some notes to answer that question on this slide. So, yes, if somebody has a mental health diagnosis and a substance use diagnosis, they may still absolutely be eligible for ABD. It's the situations when there is only, or I should say DSHS has determined there's only a substance use disorder and not a mental health or physical impairment or diagnosis, or when there may be multiple diagnoses, but they've determined that the substance use diagnosis is the primary. So what that means is if the, let's say after 60 days of sobriety, would the impairments that make it difficult for the person to work, would that still persist? I'm sorry, did someone follow-up question? Oh, maybe someone just was off mute. What I will say about that, and I feel like I may be repeating myself, but when I get in these presentations, I have blinders on, so I may have just said it in my mind. I have clients that have been denied because DSHS determines that their disability is primarily due to substance use. And I have helped them get like another mental health impairment to show that actually the other diagnosis is what's really making it challenging for them to work, or maybe they've completed treatment, and so we can show that there is this period of sobriety where the other impairments persisted. So co-occurring dual diagnosis, they may be required to attend treatment following when they get on ABD. That might be a requirement that they have to do, and then show that they're going through treatment to be able to keep their ABD. But if somebody is dealing with substance use challenge, they should still absolutely apply, and they may still be eligible. I say may because of course it's client by client, so I can't make a general statement, but I wouldn't want someone to not apply for ABD because they're concerned that they're going to get denied because they are, currently dealing with a substance use issue. I hope that answers the question.
And Jonah, I see you have questions around similar harm reduction kind of services, and I see your hand up. So if you want to ask your question, please do.
Oh, I had a question earlier about whether the liquid assets that you mentioned also include not just stuff in bank accounts or retirement funds, but if they also include physical liquid assets like jewelry, CDs, stuff like that.
Yeah, that's a great question. So usually it's not like household goods. They're not gonna take an inventory and ask like what physical goods that you have. If you mentioned CD, so I'm not sure if that's like music, you have a valuable CD, or if it's like a certificate of deposit at the bank, that would count as a resource. If you have any property, that might count as a resource. It kind of depends on, do you own the property? Are you living on the property? But if someone has, like they have a title to a plot of land somewhere else, which has happened with our clients, and we've had to get proof that that's actually the family owns it or they don't have access to it. But when you apply, they there's a section on the application that asks about resources, but you don't necessarily have to list like the couch, the TV that you own, those normal household goods wouldn't be included. If someone has like a very valuable jewelry collection, I can double check. I kind of would imagine that might be counted as a resource, but anything that's just like a normal household belonging isn't going to be used in that calculation.
Okay, great. Thank you.
Yeah. Okay. If it's okay, I might keep plugging along because I want to make sure we get to the how do you help clients get on these benefits. So I can't see anyone nodding, but I'm hoping I'll keep going. Is that
Keep
okay,
going,
Jody?
Hannah. That we have
Okay.
a lot of questions coming in. So what I might do is have you keep going, and
Okay. I have this section that's all about like writing letters of support and helping clients get mental health evaluations, which I think would be very valuable. But after that, I have another pause for questions. So
great.
I'll stop there.
Okay.
Okay. So
Thanks.
we talked about income, resource, citizenship. The big often challenge for clients is proving that they have a disability that would be eligible for ABD. So this is what you have to do. You have to prove that you have a disability, which is point one, and that it prevents you from working. So I mentioned our client, Sam, disclosed that she's diagnosed with PTSD, depression, and arthritis. She hasn't been able to work in the work that she used to do before. She can't be around crowds. So would she be a good candidate for applying for this benefit? Well, we have to go back a little farther. What does disability actually mean? And I will say this is disability for DSHS. This isn't like a generalization by any means. This is just what the rules require. So you have to be unable to work because of a diagnosed physical or mental health impairment that is expected to last at least 12 months or result in death. And what work means is substantial gainful activity or earning less than $1,470. And that number changes annually. Sounds like, where did that number come from? It's kind of random. That is set by the Social Security Administration, what they determine to be like working if you earn more than that amount. And that's why it changes annually, because those numbers are adjusted. So Sam, our client, she's only earning about $100 a month doing the Uber Eats delivery. So she might still be eligible. So if you have a client that works very part-time or sporadically, they can still apply. It's just if somebody's working, and earning more than that amount, or they're actually working part-time or full-time, that they're probably not going to be found to be eligible. So how do you prove disability? It's based on recent medical evidence about the physical or mental health conditions, including the diagnosis, and then how it actually impacts your ability to work. So if you need help, you or the client needs help getting or paying for these medical records or evaluations or exams, DSHS is actually required in the law and the rules to help the client get that information. So if you are working with a client and DSHS isn't helping get those medical records, or there's some other challenge, or maybe they're not helping them schedule an appointment, definitely reach out to us, because that's an advocacy piece where we can get involved, because DSHS is supposed to help the client get the evidence they need to be able to determine if they're eligible or not. Now, one thing I will say is not every healthcare professional can provide that diagnosis that's required for eligibility. And the first step is you have to have that formal diagnosis and then show how it impacts your ability to work. So if you have a physical impairment, this is the list of providers who can give that diagnosis. We will be sharing these slides, so I won't go through it now, but you can just get a sense. It's medical providers who deal in these physical impairments. If someone has a mental health impairment, this is the list of individuals that can provide that diagnosis. So things like a psychiatrist or a psychologist. So this is another tip. If you have a client that, maybe they're not connected with a mental health professional, or maybe they're working with like a social worker or a mental health practitioner, someone who's not on this list and can't give that formal diagnosis, the client should ask DSHS, or you can ask to schedule a psychological evaluation for your client to get that formal diagnosis. It's free to clients. I know someone mentioned earlier a question about, there are long wait times for mental health clinics. It's hard to get clients in. These psychological evaluations through DSHS can usually be scheduled within like 1 to 2 weeks. They're over the phone. They are with contract doctors, so they are independent doctors who are contracted by DSHS to do these evaluations, and it should absolutely be free to clients. Generally, at this point, they're all over the phone, which is good because it's more accessible for clients. But then, of course, there's the drawback of this person isn't able to, see and visually interact with the client. So there's kind of plus and minuses about that. I just want to make sure I'm not missing my notes. Okay, so DSHS, they need that diagnosis first. Once they get that, then they're going to look to see, well, do the symptoms and impairments make it difficult for the person to actually work? So after you have the diagnosis, this is a list of healthcare providers that can explain how the impairment impedes the ability to work. So this is where the mental health professional or the clinical social worker or chemical dependency professional, this is where their information can shine and help the client. And where does DSHS get this information? It's generally from either medical records, evaluations, or letters of support. So this is a really great area of advocacy for these types of medical providers. And usually this information is going to be included, like, let's talk about Sam for a second. I mentioned that because of her PTSD, she hasn't been able to work, like she can't work in a crowded environment or interact with, other coworkers. This might show up because she has a clinical social worker who makes a note in her case note that she was really anxious after having to wait in a crowded waiting room. Or Sam explains in her first intake with a mental health professional that she gets really anxious in crowds. So that's how this information is going to show up to be considered for our client's case. Okay, so I was rushing a little bit because I wanted to get to this point. Letters of support. I call these letters of observation because it's more about what service providers and case managers see with the client, what they observe, and then communicating that to DSHS. So this is a great area of advocacy for case managers, social workers, mental health professionals. These are just some examples, this slide and the next slide, of what a sample letter of support can look like. So I always recommend introducing yourself, your credentials, what your relationship is to the client, and the length of time and frequency of your meetings. So, this is a case manager who's been working with Sam for over 2 years. They interact with Sam on a daily basis, formal appointments. It lays the basis for this letter of support. You actually do know this client and you've been able to observe them a lot. If you have any information about the diagnosis, you can include it here. If you actually have a copy of their mental health assessment, you can include that in their letters, in the letter of support as well. Or if you know that they've done a assessment, physical or mental health assessment, you can include that information there. So I mentioned that, only certain types of providers can provide a formal diagnosis, but it doesn't mean that you can't also include that information if you know about it. And then the letter should mostly focus on symptoms and impairments that you've personally seen or observed with the client. So the next slide has some more examples. You can see that things like, I've observed Sam's concentration appears to be impaired. And during our meeting, she's only able to discuss one topic and needs to be redirected often. Well, that can be compared to a work activity of being able to stay on task without special supervision. Or this last bullet point, Sam needs at least 2 reminders before our appointments. I send her a text and a phone call to remind her. Well, that speaks to Sam's ability to get to work on time or be able to maintain a regular schedule. So the idea and my kind of tip is whatever you put in a letter, think about how it relates to kind of a work-like activity. because that's what ABD is all about. It's for people who have a disabling condition that makes it difficult for them to work. So, anything that you've seen that might show that it would be difficult for this person to be able to maintain that job. Yes, I think that's what I wanted to say about the letters of support. And of course, you can include your name and your contact information in case they have more questions for you. So, physical and psychological evaluations, there were some questions about this earlier, so I wanted to make sure to get to it. If your client needs a formal diagnosis of, let's say, a mental health impairment, DSHS will and is required to schedule this free evaluation. Usually what DSHS may do is they will first request the client's medical records, and if there isn't enough, then they'll schedule that evaluation. But you can absolutely ask for this during the application and interview process, especially if you know the client hasn't had an evaluation in over a year, or the client isn't currently seeing someone. That can speed the process along instead of having to wait for the medical records to come or not come and then have to request this evaluation. Now, a client's medical provider, either like a primary care or mental health, may also be asked to complete an evaluation. I have a sample on the next page. I mentioned earlier, well, I've mentioned on this page too, that DSHS will schedule these free psychological evaluations. It's great that that can be done quickly and over the phone, but also that person doesn't know the client. They don't have that history. So, the best is if the client's primary provider can fill out that evaluation, and you as a case manager or service provider, if you're able to make that connection with the client and a provider and then have them fill out the form, that's kind of the best practice. But if that's not possible, you can ask DSHS to schedule that evaluation. And then if the client needs help paying for a certain exam, tests, radiology, you can ask that DSHS pay for this, and they will pay in certain situations. And so if you have a client that's trying to get something covered, DSHS isn't paying for it, definitely reach out to us and we may be able to help with that. So this is just an example of what the first page of the evaluation looks like. And I've included the link for the physical and mental health. So, if you're working with a client and you think they may be applying for ABD, they can fill out this form at any point, even have it ready with their application to apply altogether, or they can apply and then go to their doctor and see if they'll fill this out. Some doctors will fill out these forms, some won't. It depends on the individual provider. So I will pause there before I actually talk about how to apply to answer some questions before we get too far away from that.
Yeah, okay. So I've been tracking questions and trying to group them into similar ideas. So a couple quick and dirty that are, sort of, we can kind of quickly cross off the list. Is the Ask a Lawyer help only for King County residents?
That's a great question. If you are outside of King County, you're more than welcome to still send a question through Ask a Lawyer. We just might not be able to take the referral. Like if it ends up being more than just a question and the client actually needs some kind of advocacy, we're limited to King County. But yeah, please definitely still, if you're outside of King County, shoot us questions through Ask a Lawyer. There's no problem.
Great. Can families write a letter of support?
Yes, absolutely. Families, caregivers. There's kind of this hierarchy with this evaluation process. They look at first like the MD or the psychiatrist, and then it's clinical social workers, mental health professionals. But there's room for family members, case managers. I've had former employers write letters that have outlined why the person wasn't successful, that have helped. So you do need that diagnosis and those kind of objective medical records, but yeah, family, friends, caregivers can write letters.
Okay. So this one is, what is the best way to get residents in my permanent supportive housing program that have no income connected with ABD HEN what are the qualifiers? They're expected at some point to get some type of income, but have already been repeatedly denied SSI and have conditions that preclude them from obtaining employment.
So the first step really is to start the application process. I will make a note about this. We have a social worker on our team who helps people apply. We work with clients who have a lot of challenges and wouldn't, be able to apply on their own. So, the folks that you mentioned, that might be a good referral for our program. The first step really is to apply. And I have some tips in a couple slides about like how to help clients get through the application process, like how to actually push through. But I would say, if you could be present when they do their interview with the social worker, which I'll talk recently, to make sure that, the client it's very private information. They may not be sharing all of the challenges, or they may not be sharing everything that makes it hard for them to work. But if you are a case manager, can be on the call and can get that information to the social worker, if you are able to connect them with an assessment or evaluation, so you get that medical records, if you can write that letter, individualized for those individuals, all of that can help them get on ABD. So they get this cash assistance, they'll get help applying for SSI, they could get that HEN referral. So hopefully that answers the question.
Okay. And I see some hands. I've got a couple more questions. So there's about 3 that are related kind of back to disability, mental health, substance use. So can you speak a little more to treatment requirements regarding substance use disorder and mental health? These requirements are extremely hard for people to meet. This is a person that's working as a case manager and confident this person will be approved for SSI and might lose their ABD in the meantime because they have so many barriers trying to get to the treatment requirements. And then sort of in that whole conversation, like someone else is asking, like, is methadone considered a treatment option for ABD? And like, how does DSHS determine a disability that's not primarily due to drug or alcohol use? So those are kind of the substance use, mental health, disability related questions, if you can address some of that.
Yes. So I'm going to do my best to answer all those questions. If I miss something, just let me know. So first, about the treatment requirements. So if someone is approved for ABD, they may be required to do certain treatment. Not everybody has to do that, but based on why somebody was approved. So it could be substance use treatment or mental health treatment. And usually what that looks like is they might have to see their case manager or their provider once a month, and then that provider sends proof that they attended to DSHS. One thing I will say is, if someone is not able to comply with the treatment requirements, and I'll mention this later, if they have kind of a good reason for not being able to comply, like transportation, or the provider isn't working there anymore, or let's say they're homeless and so they're having to live where they can find housing, and it's, they're just not able to get to the provider. That might be a good reason why they weren't able to comply. And so if there's a case manager who can help the client communicate that to DSHS so that they're not terminated or found to not be in compliance. Another thing, which I'll mention at the end, but I think would be good here too, is there's something called an equal access plan, which is kind of like a disability accommodation. And part of that is the person has some kind of limitation that makes it difficult for them to interact with DSHS the way someone without that limitation would. And that could be extra time to do things that they need to do. So if they are having trouble getting to the treatment, but they have an equal access plan, DSHS has to do a certain amount of things before they can terminate someone or, kick them off benefits. So that might be something that would be helpful for the client if they don't already have an equal access plan. There was a question about methadone and whether that might be a treatment that would meet those requirements for DSHS? I don't know the answer to that. I'm sorry, I don't know if that is or not. Okay, I'm trying to think if there were other parts of the question that I missed.
I think you covered most of them. And folks can, always email us or, message Tim or I just to make sure, like, no, I didn't quite get my question answered, and we'll follow up because you all have really amazing questions, and I'm loving all of this coming in. And Q, I do still see your hand, and we will get to you, so keep it up. We've got a few questions that are just back to some of the basics around, just qualifying for ABD and that 1470 annual income, and, if can an adult claim a dependent on taxes, and what about parents caring for a child under 18? And then another question that came in was immigration requirements for ABD, which I threw it in the chat, but I'm just going to put it out there for everybody. We are going to take a little bit of a deeper dive into this on the 27th, April 27th. So we've got that registration there. Hannah, I will hand it to you to answer some of that.
I will say, I don't know if everyone can see, there's a pink line. I'm not sure what that is, but maybe
I'm not sure either. It kind
of
just appeared, but
yes. Okay. Yeah. So I'm sorry. I should have mentioned this at the beginning, and of course I had it in my notes, but I get nervous in front of a big crowd. If there is a parent who is caring for a minor child, or an adult who's caring for a minor child, they would actually want to apply for TANF, which is the Cash Assistance Program for Low-Income Families. They would not be eligible for ABD. It is for single adults or married couples. If you are claiming someone as a dependent on your tax return, you're able to claim them, but they're not your biological or adopted, they're not your child, but you're caring for them. That client may still be able to get TANF. There's this, if someone's acting in the place of a parent, or you can get a TANF only grant. So definitely, if there are kids involved, I recommend looking at TANF first. I'm sorry, I forgot what the other
one is
was.
If the adult could be claimed as a dependent on taxes, are they financially eligible for ABD? I think I said it wrong the first time.
Okay. So maybe like a 19-year-old who's on their own, but their parents are still able to claim them as their taxes. They would still be able to apply on their own. If somebody is like supporting them financially, maybe somebody like a parent is paying for their rent or paying for their giving them cash, that might count as income. So, that could be something that they have to show or overcome. But, if they're an adult and they're a single adult, even if they're being claimed on someone else's tax, as long as they're not getting paid, someone's giving them cash or paying for all of their rent. Someone can have, I remembered a question, if someone's on Section 8, can they still be eligible for ABD? If somebody is getting rental assistance from like an agency, that's okay. But if a friend or family member is paying for someone's rent or paying their bills, that may be considered some sort of income. So just mentioning that here.
Right. And then, so the limit to claim an unrelated adult on taxes, is that the same number, that 1470, and is that 1470 annual?
Okay, so if I understand the question, that 1470, 14, that is a monthly dollar amount that if the individual is earning more than that from wages, they're going to not be eligible for ABD because they're working. So if they have a disability or a disabling condition, but they're able to work, they're not going to be eligible for ABD, because it's not just that you have a disabling condition, it's that it prevents you from working. So it's a monthly amount, which is why, like our fake client Sam, she's kind of working, but not a lot. She's still going to be able to be eligible to apply.
And then immigration requirements for ABD. And if this is too much, we can defer this for time, we could defer this to the 27th. So I'll.
Yes, I think if it's okay, I might have to, not that I don't want to respond to the question, but it could be a whole presentation in itself. And I'll be honest, as far as immigration requirements, every time I have a client with that question, I go back to the rules myself because there's a lot of and, ors, if, and timeline. So I wouldn't want to just spout something off and have it be even just slightly off. So yeah, maybe we can save that for later.
I think that's good. Q, do you want to ask your question?
Yeah, I was just wondering about the diagnosis requirement. I was just wondering about, I do have a client who, and this is not, it's her child, so this client is not eligible for ABD, but she's had an issue getting assistance in the past because her child has a medical condition that does not have there is no diagnosis for this yet. Like they have a collection of symptoms, but there is no like single diagnosis that makes sense of everything that's going on with this child, unfortunately. So if I have a client who is disabled and is significantly impaired and unable to work, but their medical issues are so unique that they don't have a formal diagnosis, can they still apply for ABD on the basis of the impairments that they're experiencing, or do they have to be diagnosed with some formal medical issue?
Yeah, that's a great question. There is this requirement for like some kind of diagnosis, but that could also be like, this isn't what you're talking about, but like fibromyalgia, just for an example, that's kind of an amorphous diagnosis. There's, it can be hard to diagnose and it can look differently in a lot of different people. So someone, and I'm trying to think of like what the diagnosis might be, like unknown diagnosis, but there's something there, but we don't have a name to call it. Yeah, there would need to be at least some kind of formal like diagnosis, but it could also be if they have a care provider or medical records, and there's even just the symptoms are included. I mean, that's a case that for example, if the client kept getting denied, I would take that case to a hearing and I would compile all the medical records and show that even if there's no name for this, there's clearly something. Yeah, I think my suggestion in that case, it might be to, if they have a primary care provider, if there's somebody who could fill out, like there's that physical evaluation form or that mental health evaluation form, which there's only one line for the diagnosis. There's a lot of other sections for like impairments, severity. So I would still have them apply, and maybe if they can have the person that they're working with fill out that form. So even if there's not like an exact diagnosis, there's still that medical provider outlining all of the symptoms and impairments. That might be the best answer I have to that question.
Thanks,
Awesome.
Hannah.
Thank you.
Thank you, Q. Vincent, please ask your question.
Yeah, so I have I'm working at a permanent supportive housing program, and I have one of the residents that is from Idaho. They just moved here from Idaho, but they got housing here. They had DSHS benefits in Idaho. I'm also trying to find out about getting her ABD due to some mental health complications that she has, and she's also a DV survivor as well too. So I'm trying to find would that be an issue? The fact that she's coming from another state, she's never lived in Washington for the past month. As far as her getting ABD and getting connected to a mental health provider, and also once she gets connected with a mental health provider and they do a diagnosis, do I on top of that I have to write a letter for her confirming how this impacts her ability to obtain work? If you can answer that.
Yes, great question. So
Hannah, there's another question in the chat about somebody returning to Seattle within a month and having done some, has a disability, done some treatment, do they have to actually be in Washington to apply, or can they apply out of state? So just pairing that with this really great question.
Yes. Yeah. No, those are both great questions. So as far as somebody coming from another state, if they came from another state, but they're in Washington now, they can absolutely apply, even if they were receiving some kind of state disability. They do have to, there's this box on the application that says, have you received food or cash benefits in another state within the last 30 days? So they're going to want to check that box. And what that does is just prevent them from like getting an overpayment, because you're not supposed to receive benefits. This is also for food. You're not supposed to receive benefits in two different states at the same time. Oh, sorry, there's an echo. I don't know if anyone can hear that. That's going to distract me. Okay, so yeah, so that's the only issue with coming from another state, is that you just want to make sure that their benefits closed out in the other state before they start receiving them in Washington. And DSHS can also get medical records from the other state. So if they were seeing a doctor in Idaho, they can, there's not like a boundary where they'll get medical records. They'll look at records from any part of the state. And you don't have to, as a case manager, write a letter. Especially if they've done a mental health assessment, from psychiatrists or psychologists, if you have that assessment, that's going to be really good, strong evidence. So that's actually not better than a letter, but definitely you want to have that in place. So you don't also have to write a letter unless you want to, or you think the assessment missed something. And then for the question about if you leave the state and come back, you do have to be like a Washington state resident to apply. So if you've gone for treatment in another state, but you have a return date, you're planning on coming back to Washington, you can still apply. You just want to make sure you're not receiving benefits in two states. If you are in another state and you're thinking about coming back, but you're not sure when, I would say you want to wait until you have your return date or you're back in Washington, so that you're not inadvertently receiving benefits in two states.
Okay. I think we've gotten to most of the questions. There's a couple that are like related to House Bill 1260.
Oh yeah.
Hillary from Benefits Law Center has been lovely. Thank you for answering some of those SSI questions in the chat. Very helpful. Why don't we move on, Hannah? And then folks, if we didn't quite answer your question correctly, will you please private message myself or Tim, and we'll make sure we raise that back up and try to get you the answer that you need. But Hannah, why don't you take the floor?
Okay.
Again?
And I do have more tips and tricks coming, so don't log off yet. So how to actually apply? There's 3 ways folks can apply online. They do need to have access to an email address because they get a verification code. They can apply in person at a local office or over the phone. And you can also apply by paper. You can mail or fax that in to DSHS. Oh. So the actual application, there's 2 parts to it. There's the financial interview and review, and then there's the social worker part. If you've ever applied for any kind of DSHS benefits like cash or food, it's the same application. You just check the box for cash assistance. And the first part is this financial review. Again, you can do it over the phone or in person. If you actually apply over the phone, you can do it all in the same phone call. You talk to the financial person, then they transfer you to the social worker. If you complete the application online, you can call the same day for the interview. I know wait times are really long for DSHS, and even going into the office is really long. Unfortunately, I don't have like a good solution or workaround. Sometimes what I do is I will call DSHS and I'll wait on hold and then just conference the client in when I get through to someone. So just, I'm sure there's people here on the phone who have ideas or tips to get in touch with DSHS, but just wanted to make a note about that. So the really important part about ABD is the social worker interview. This is where the client is going to share information about disabilities and their work history. So a tip that I have, and I try to tell this to all my clients, is they really want to tell DSHs about all the physical and mental health conditions, even ones that seem minor, like high blood pressure or nightmares or trouble sleeping. And that's because someone's, one condition might not be severe enough to qualify, but a combination of these impairments, that might be what's severe enough to show that they're eligible for these benefits. At this point, the client's also going to have to tell DSH just the name and address, or if they have the name, that's also good, of all their medical providers that they've seen in the last 90 days. So that's primary care, specialists, hospitals, emergency rooms. If they're working with a treatment facility, they have a social worker. They want to provide all of this information because the first thing that DSHS does is they send out medical requests. So if something's missing, they won't know to get those records for the client. So that's why it's important to share everything during this process. So some tips for helping clients apply. First of all, advocates can be there for the financial and social worker interviews. You can actually be there for anything as long as the client gives permission. You can help clients get copies of medical records. I had a client once who was kind of tech savvy, so their provider used MyChart, or it was one of those online MyChart type programs. And they were able to just download a PDF of their medical records, and then I submitted that to DSHS. And we got that client approved like 2 days later, even though the request to the provider was still pending, they hadn't gotten the record. So, or if you're part of a clinic and you can just get those medical records, you can help the client ask DSHS to schedule an evaluation if necessary. We've talked about that. And advocates and the client as well can follow up with the DSHS social worker to make sure that they are actually getting all the medical records. That's something that our social worker does a lot. She just kind of calls and makes sure that that worker is doing what they are supposed to be doing. And then advocates can write letters of support for their clients or help clients ask their providers for these letters of support or for these evaluations. Okay, so some common reasons why ABD might be denied. I mentioned, I've been saying medical evidence a lot. So that's like medical records, test results, evaluations. Sometimes DSH just doesn't receive it within the deadline for the application to be reviewed, or the medical evidence maybe isn't current. So it's like 6 months old or a year old, there's nothing current. Or the medical evidence itself is insufficient. It doesn't prove disability, it doesn't have the diagnosis, or the medical records, it just doesn't say anything about the client's impairments. Also, the physical or mental health evaluation form, it might not have been completed or maybe wasn't completed correctly or fully. And also, I wanted to mention, the mental health evaluations done by the contract provider from DSHS, there may be implicit bias in their evaluations. I know I'm really pushing those evaluations because when client needs that diagnosis and they don't have another option, it's a good option. But I also just want to acknowledge, like, that provider doesn't know the client. They don't have a history and they're over the phone oftentimes. So maybe there's something that they're missing, or there's some kind of bias in that evaluation. Just trying to see if what I wanted to actually say on this slide. So oftentimes my office gets involved when ABD is denied for any of these reasons. And what we normally do, and what providers and case managers can do, is we will go get the records ourselves, especially if it's maybe the provider, like the hospital, just didn't respond to the records request, or the client actually has their own copy, but they didn't know that it would be helpful to give that to DSHS. So we might request medical records. We might help a client get connected with a mental health evaluation and then provide that assessment, or try to help the client connect with their primary care provider to get a referral to a specialist, try to get the medical evidence to show that the client is in fact has this disability. And I just seen what I have left. Okay. After this slide, there's a question slide. I'm going to just wrap up this section and then I have a pause for questions. So what happens when someone actually gets approved for ABD? We talked a little bit about this. Usually ABD, it's approved for 24 months. And after 24 months, there is a review and the client will need to provide updated medical records. They also are required to apply for SSI. And if SSI gets denied, the client does need to appeal or they will lose their ABD. So it is important they need to follow that SSI claim all the way through. And then as we've talked about, they may be required to participate in treatment such as mental health or substance use. And again, if somebody is having trouble participating in whatever their requirement is, maybe ask for an equal access plan or explain why the client has a good reason for not being able to do what they're supposed to do. Or that might be something that a client can be referred to us so we can try to negotiate a different requirement for the client. You know, if the client is required to do mental health treatment, we're not going to be able to get that thrown out, but we might be able to help the client have a plan that they can actually follow more easily. Okay, so I'm just going to briefly talk about some of the reporting requirements. This is when somebody is actually on ABD or any other benefit from DSHS. They get an award letter, and that will clearly state what needs to be reported between reviews and how to report it. But generally, it's things like a change in income or like their household composition. They got married or they're not married anymore. And then, of course, if your resources exceed $6,000, they can report things by calling DSHS, going in person, sending a letter, or going on their client portal in Washington Connections. I always recommend keep a copy of your own reporting. So if something happens down the road, you can show, yes, I reported everything timely. And then when you're supposed to report these changes. Generally, you have to tell DSHS about the change by the 10th day of the month following the change that happened. So what this means is, let's say our client Sam, she got a new job and she got her first paycheck April 1st. She'd have to report that new income by May 10th, so the 10th day of the following month. And then the date that it happens, like if you get a new job, it's not when you start the job, it's when you first get that paycheck. I'm wondering, my next section is how to avoid benefit pitfalls, some tips. So I can pause here for questions if there's anything, or move along to the next section.
There's a few.
Okay, pause for questions.
So any advice on how to get copies of medical records that were used in the evaluation? Folks have had experiences where they've called DSHS, they've transferred to the voicemail for records, but then never heard back.
Yeah. Yes. And honestly, I have those same issues because of the workload, of the DSHS social workers. You may not get that call back. What I try to do in those situations is if you have a copy of the records and you've already submitted them and you're just not sure if anything's actually happening, this may or may not be very helpful, but keep a record of what you've submitted, because if the client gets denied because lack of medical evidence, and if they have to appeal, and then at that point you're able to talk to someone else who does have a phone, like an email address, who has a phone number, and then if the client can, you have this copy showing that you gave these medical records on this day, they just didn't get uploaded or processed, that can help the client get approved with, potentially a back pay to the date that they actually did submit them. But unfortunately, I don't have a great trick to get through the challenge of getting hold of the caseworkers at DSHS or the social workers, other than faxing, mailing, and then we try to call. And if we can't reach the actual social worker, sometimes what we'll do is we'll call through the main number, and the navigators can send a message to the social workers. So if you aren't able to leave a voicemail or you're not getting a call back, you can call the main customer number and ask the navigator to like, they'll ping the social worker. So sometimes we've done that and then been able to get a call back.
And related to this just came in, how do we make sure DSHS got the records, or is there a sort of closing the loop to know that that actually was received?
Yes. And that's one of the things that our social worker does a lot. And, you know, if you have the capacity to do that, that's a really important piece. And so the way to do that would be to call or contact either the social worker assigned to the case or the customer service number. And then you may get transferred to a different social worker who can look up the client's case. Kind of just bugging DSHS until you get that answer. And then if you don't get an answer and the client gets denied, just make sure that you've kept a record of your attempts for communication, anything that you've sent. So if the client starts working with us, for example, we'll have all that information from you to help them if we have to appeal the case or go to a hearing for the client.
And I will just say that these are really great questions and scenarios, and Tim and I are paying attention and we save all these chats. Hannah, along with our colleague, Sarah Robbins, who is also a public benefits attorney, along with some of our REACH colleagues, attend a meeting with DSHS, raising up these types of barriers, right? Like can't get through on the phones, you know, can't get records, you know, needing verification. So these are good things for us to be hearing, even if we don't have awesome answers or solutions for you in the moment. We are paying attention to that and we are raising them up. So I really appreciate you calling them out. So we've got two more here questions. Can people ask for another evaluation if they disagree with the eval that they got?
If the first evaluation was like the DSHS evaluation and they disagree with it, I'm not sure. What I have normally done when we've gotten an evaluation that we didn't disagree with, we've worked with the client to get connected somewhere else, have another assessment, or try to get some other kind of evidence to show like why that first assessment isn't accurate. I don't know that that DSHS is going to schedule a second evaluation just because the client disagrees, unless they have some other kind of document or evidence, or maybe another assessment showing that the first one was really just out of line. And yeah, I'm not sure if they would be able to do that or not.
Amanda, that was your question. You want to, I see your hand. You want to come off mute?
Yeah, thank you. That totally makes sense. Just trying to connect with someone else. I guess I'm also realizing how do you even get access to that evaluation once it's done? I don't think I've ever actually seen, like I've seen like, oh, the denial, it wasn't sufficient evidence or whatever. But if someone did get a mental health eval from one of those contracted doctors, like how does someone even see what the eval said?
Yeah, what was even said? It's a great question. Because also usually, let's say someone gets the evaluation and they're approved, you know, usually it's like a day or two and the money's on their card. You never think to see it. How we normally get copies of those evaluations is when you file a hearing request or when you appeal a denial, you ask DSHS for a copy of the client's case file. And the evaluations are included in there because they have to explain why they denied the client, and it includes a copy of the evaluation. So that's normally how I see it. Yeah, that's normally where I get those evaluations. And so that's something that the client you don't have to just be an attorney to ask for the case file. That's something that the client can ask, or a case manager can ask as well. And that usually happens once they've appealed.
Okay, Hannah, I'm going to check in with you. There was one more question that came in that was around a question around, resource limits about 2,000. So yes, I just want to flag that for you. And then I'm looking at time.
I know I'm looking, and I want to talk about like some ways to avoid problems and when things go wrong. What I will say about the 2,000 is SSI has a smaller resource limit than ABD. It's $2,000. That's like for Medicaid, $2,000. ABD uses the same resource limit as the other cash program. So TANF is a $6,000 limit, ABD. So that is something to keep in mind. If someone's on ABD, they have up to $6,000 they're allowed in resources, but if they get approved for SSI, they're going to have that $2,000 limit. So hopefully that answered what I think that question was. I'll move along to this section, and I'm also happy to stay on after 11 and answer more questions, if that's helpful for folks. So let's say you've done everything right, the client has done everything right, but there's still, there still might be an issue with benefits. These are some tips to avoid problems with the benefits. One thing is to report changes in circumstances. This is something that we've talked about. If there is a change in income or like household composition or resources, if the client reports that timely, that can avoid termination or overpayments. If you're not sure if it's something you have to report, you can send us a letter and ask a lawyer, or of course, DSHS will be able to tell you that. Okay, so complying with program requirements. This is something we've also talked about. If you're required to apply for SSI or maybe do some kind of treatment, you should comply with those programs or tell DSHS why you cannot comply. So this is the kind of the good cause or good reason. If you have a good reason why you can't comply, even if the good reason is related to the disabling impairments, like there's maybe some kind of limitation to be able to comply with this requirement, you want to report that to DSHS as soon as you know that you're not going to be able to comply, or as soon as that happens, to hopefully avoid like a termination or a reduction in benefits. Another tip, and I mentioned this before, is to request an equal access plan. This is, sometimes I call them a disability accommodation, but it's not just related to disability. It could be if there's, maybe they need large print or something in a different language. And part of the equal access plan are things like getting extra time or getting a phone call and a letter, or having help at the DSHS office to fill out paperwork, or getting a quiet room to meet in at the DSHS office. So these are all things, if people are having trouble complying with benefits, or their benefits keep getting turned down and they're on this cycle, an equal access plan could be a good option. A client can ask for an equal access plan, and DSHS workers are also supposed to screen clients when they talk to them if they kind of notice that there's maybe some kind of limitation. But if that doesn't happen, a client can ask for it, and a case manager can help a client advocate for that. Another option is to designate an authorized representative. So this is someone who can speak to DSHS on the client's behalf, and you can actually be an authorized representative only to get copies of the notices for clients. So we do this sometimes, especially if we have clients who maybe they're chronically homeless and just have barriers to be able to get their mail regularly. So their benefits kind of just always get turned off because they miss notices. So we get a copy of the letter so we can help find the client so that they don't lose their benefits. So you can be like a full authorized representative, do the interviews for the client, answer questions about the client, or you can do it just so you get copies of their notices. And this is, I think I only have maybe two more slides left. So what happens if something does go wrong? A client's benefits are denied, reduced, terminated, they get an overpayment. So the first thing to do is know that you can appeal any adverse action, anything negative that DSHS does for someone's benefits. You have the right to appeal, and you do this by requesting a hearing, which is essentially, it's when somebody other than DSHS looks at the case to see if DSHS did something wrong, or if the client did do what they were supposed to do. These are administrative law judges, so they're not part of DSHS. So to request a hearing, you could call or write into DSHS or the Office of Administrative Hearing, especially if you're having trouble getting through to DSHS, you can call the hearings office directly. You have the right to be represented by an attorney. You aren't provided an attorney, but you can have anybody there with you at the hearing. There's no magic word to request a hearing. You don't have to say fair hearing, administrative hearing. You just have to express disagreement. I disagree with this. I don't think I should be denied. I think I am disabled or have a disabling condition. There is a form people can fill out, but they don't have to. They can just call DSHS and say they disagree with the decision. And then just wanted to note, there are deadlines to request a hearing. Generally, you have to do it within 90 days of that denial letter or that termination notice. If somebody is getting ABD and they want to keep getting the benefits while they're doing this hearing, they can request continuing benefits. You do have to do it within 10 days of the date of the letter. So this is something, if you're working with a client and it's almost 10 days or you're not quite sure the date and they do want to get continuing benefits, it's a good idea to just call and request a hearing. If the issue gets resolved, they can always withdraw the hearing, but at least they've preserved that right. And then there is something called a reconsideration for ABD. So if you get denied and it's because DSHS didn't get the medical records or they didn't get enough, if you give them more evidence or information or get that psychological evaluation within the 30 days, they'll review the same application again and the client might get approved. And you could do the reconsideration and the hearing at the same time. There's some notes about reapplying, you should reapply if you think it was correct that DSHS denied you, but your situation has changed. Maybe you now do have a formal diagnosis or you've been in the hospital, so things are getting worse. That's a situation when you might want to reapply. And I have a couple slides about HEN, but honestly, I do think the folks at HEN earlier did a really great job covering that. So I will just pause here for questions.
Thanks, Hannah.
And then I do have, why I'm doing questions, I will pull up our referral. So you have all of our information while I'm taking questions.
Awesome. So Vincent, I see your hand. We'll get to you in just a quick sec. We had another couple questions come in, but I'm going to take this moment to share again our post-training survey. We really love feedback. We want to make these trainings better and really get to the information that you all need and what else we need to be covering. So we definitely love to hear from you. I think I had another thought that went totally flying out of my head. So there it is. But I want to take a moment to thank all of you for, these were just amazing, wonderful questions. Super. This might be our most engaging training that we've held so far. And it's been really, really lovely. And I really just commend you all for hanging in there with us as we were getting to questions and getting everything in there. So if we didn't get to it, we still have a couple minutes. So one quick thing, and I think you were touching on it, Hannah, right at the end there, but is if someone was denied, it's been more than 90 days, can they apply again?
Yes, they can absolutely reapply, especially if maybe they've gone to a doctor, they've had an evaluation. So clients can reapply at any time. I would say, you could appeal, if you get the denial letter, it's just a couple weeks later, you really think that you are eligible or you're worried that DSHS just didn't get those medical records, even though you sent them, definitely appeal. But if it's been time, things have changed, you can always reapply.
Great. Vincent, thanks for your patience. Take the floor.
So I have two quick questions. One's a real time issue. One, how long from start to finish everything goes according to plan? There's no holdups or barriers. Should it take for someone to do an application to receiving ABD benefits?
Yeah, I would say I'm just kind of thinking an estimate, like minimum 30 days, It could be 45, it could be up to 2 months. If you get denied and have to appeal, it could be longer, that could be 3 months. One of the thing that takes the longest is getting those medical records. Like DSHS will send the request, get it back. Then they have their reviewer review it. So anything that you can do to help the client, like get those records ahead of time or get those assessments like right at the beginning, anything you can do to help get the medical evidence in the case file, that's the best way to expedite these types of cases.
Okay. And my other question is a real time when you were saying earlier about some tips for doing the application process, getting it started. So I have someone I'm going to be working with today right off the bat, or 2 people. What's the best way just to straight move forward with it? Go online, try to make a phone call. I tried doing the phone call thing, but I sat on hold for an hour and then when somebody came, I got hung up on. So it's just, what's the best way to get somebody moving forward that's going to get them established securely in the process right off the bat if I wanted to start today with somebody?
Yeah, my recommendation is to do it online, which is washingtonconnection.org. The client does have to like set up, it's a secure access Washington, like email, username, password. They do have to have access to an email address because they get a verification. So, if that's something the client can do online, then you at least know that the application has been filed. They will still have to call DSHS to do the interview, but they can also walk into the office with you, or if they're able to do it on themselves, and then they already have the application, so they can just go right into like the social worker part. So especially if you're calling in the afternoon, the wait times can be longer for DSHS. Sometimes our social worker, she'll call like right at 8 a.m. The earlier the better. So if you're meeting with someone this afternoon, I'd say do it online if that works for the client.
Okay, perfect. Sounds good. Thank you so much.
Then we've got another question in the chat here. Is there a lifetime limit? Like for someone who is on ABD pending SSI, gets denied during all the appeal process, reapplies for SSI, it's back on ABD, etc. Thinking about those clients that really struggle to get on SSI, but can at least get on ABD during SSI appeals, how long can that last?
Yeah, so as long as they meet the requirements for ABD, they can keep receiving it. It's not like TANF, which has like a lifetime 5-year limit. What I will say about that is if somebody has gone through all of the SSI levels of appeal and they still get denied, their ABD will end unless they can prove it's called a new or worsening condition. So if you kind of think about ABD as the stopgap for SSI, the idea is someone is on ABD while SSI, like while they're trying to get on SSI. So if someone gets denied the highest level for SSI, like the message to DSHS is, oh, this person isn't actually like disabled under the rules. So your client can still reapply. They may just have to show something new or different, or like that the condition has gotten worse. I would say if you have a client that's in that situation, refer them to us. Those are kind of the cases that we help clients with a lot, because it's a little harder. It's not just I have a diagnosis and it makes me hard to work. It's like, okay, I have to show that something's different or worse. So, but if they get back on, they can keep getting it while their new SSI application is going through.
Great. Well, I think that covers all the questions that have come through. Everybody, thanks so much for being here, hanging with us. I'm going to throw not public benefits related here, but the coalition does policy and advocacy. And this is an action alert on the Vet Seniors and Human Services Levy. This right now is being debated by our King County representatives. And we are currently trying to increase this levy to bring more money into services for vets, seniors, DV, shelter. It's a dedicated pot of general fund money. We really want to increase it. We were working on getting it updated prior to this training started. So please, please, please take action on that. We want to be bringing more money in, not less, to maintain our services and support you all in the good work you're doing. Thank you so much for being here. Thank you so much for your patience. Really fabulous questions. As I said, we're saving this. We look at this. We're looking at the post-training surveys. We've got more trainings to come. We have a training and professional development page. We've got trainings pretty much scheduled for the rest of the year. Shout us out via email. Come to our general membership meeting tomorrow. We want to connect with you all. So again, thank you, thank you. Have a lovely, lovely, lovely rest of your day. We hope to see you tomorrow and at the next training. And don't hesitate to reach out to Tim or I. In the meantime, we can help connect you with all the folks that were here today. So be well, folks. Take care.